and welcome to the ASCO Guidelines podcast, one of ASCO's podcasts, delivering timely information to keep you up to date on the latest changes, challenges, and advances in oncology. You can find all the shows, including this one, at asco.org/podcasts. My name is Brittany Harvey, and today I'm interviewing Dr. Kim Perez from Dana-Farber Cancer Institute and Dr. Jaydira Del Rivero from the Center for Cancer Research at the National Cancer Institute, co-chairs on Symptom Management for Well-Differentiated Gastroenteropancreatic Neuroendocrine Tumors, ASCO Guideline. Thank you for being here today, Dr. Del Rivero and Dr. Perez.
Thank you. Thank you so much for the invitation.
And then before we discuss this guideline, I'd like to note that ASCO takes great care in the development of its guidelines and ensuring that the ASCO conflict of interest policy is followed for each guideline. The disclosures of potential conflicts of interest for the guideline panel, including Dr. Perez and Dr. Del Rivero, who have joined us here today, are available online with the publication of the guideline in JCO Oncology Practice, which is linked in the show notes. So then to jump into the content here, first, Dr. Del Rivero, could you provide an overview of the scope and purpose of this guideline?
Yeah, thank you so much. Well, first, we really wanted to thank ASCO for allowing us to develop these guidelines for the management of gastroenteropancreatic neuroendocrine tumors. I do want to mention that there is also another set of guidelines that I was very fortunate also to co-chair with Dr. Perez on the systemic management of gastroenteropancreatic neuroendocrine tumors. But when discussing these guidelines, as well as with the different panelists, experts in this type of disease, we also realized that the management of these tumors are quite complex, not only from the management of the disease progression, but at the same time, management of the symptoms related to the hormone excess. And because of that, we like to thank ASCO for allowing us to then not only have a discussion on the systemic management of these tumors, but at the same time, develop recommendations for the symptoms related to the different hormones that these neuroendocrine tumors may produce. These guidelines is for the management of grade 1 to grade 3 metastatic gastroenteropancreatic neuroendocrine tumors. These guidelines include the management of the different aspects and the symptoms related to hormone excess, such as carcinoid syndrome, carcinoid heart disease, how to manage carcinoid crisis, as well as the different symptoms and how to manage the functional pancreatic neuroendocrine tumors, and as well as provide recommendations in the different treatments for these tumor types, not only from the systemic management, but also from the surgical management, as well as for liver-directed therapy options and the different aspects in terms of the palliative care of these patients to improve not only the symptoms related to the hormone excess caused by these tumors, but as well as to improve the quality of life.
Absolutely. And I appreciate that overview. And yes, we'll link the guideline on the systemic therapy for tumor control for well-differentiated gastroenteropancreatic neuroendocrine tumors in the show notes for our listeners so that they can refer to that companion guideline as well. So then you just described the several different categories of recommendations that this guideline covers on symptom management. So Dr. Perez, I'd like to start reviewing some of those key recommendations of that guideline. So starting with, what are the key recommendations for carcinoid syndrome and carcinoid heart disease?
Thank you, Brittany. Yeah, I also want to thank ASCO for inviting us to do this podcast today. Just to start, I think these guidelines were really add to what's available in the literature to provide kind of a quick look for the community provider to manage carcinoid-related symptoms. I think the highlights that I would point out are we've all been using somatostatin analogs for the last few decades to manage symptoms, but with the newer treatments that are now available, we tried to highlight what does the literature support in regards to PRRT? What does the literature support in regards to using systemic therapy for disease management, but also the benefits that you will get from a symptom management perspective using other modalities? I think the highlight really is it's a multidisciplinary approach. We're now considering surgery and embolization or interventional radiology as a critical piece. And I think the third that I'd highlight is the fact that sometimes we get too focused on carcinoid syndrome and the symptoms will actually may result from other things. And the highlight in the algorithms that we've provided is
what other things cause carcinoid-related diarrhea? And let's not forget about that, because we will find ourselves treating and patients getting very frustrated with persistence of symptoms when in actuality, we should be treating something else that is causing a very similar symptom. For carcinoid heart disease, I think there are more and more guidelines that are now available to provide guidance there. But I think the major advances are that we should be utilizing heart assessment with echocardiogram, with lab values such as BNP, but also critical to this is consulting with our cardiology colleagues and making sure that we're identifying heart-related issues that are resulting from hormone excess sooner than later, because interventions on the earlier side can really make a significant impact on quality of life and associated comorbidities and mortality.
Thank you for reviewing those key points for both carcinoid syndrome and carcinoid heart disease symptom management. So then the next set of recommendations, Dr. Del Rivero, what are the key highlights for symptom management of functioning pancreatic neuroendocrine tumors?
Yes, it's very important to recognize the symptoms related to hormone excess due to pancreas neuroendocrine tumors. Up to 10% of pancreas neuroendocrine tumors may produce different hormones. Among those hormones can be insulin, gastrin, glucagon, somatostatin. So it's important to know and understand that based on what a neuroendocrine tumor is, they may produce different type of hormones. The importance of these guidelines is to also recognize some of these symptoms and how to address that, because it's not necessarily in these tumor types, besides the management of metastatic disease and the different options that we recommend for metastatic disease from the systemic therapy, such as chemotherapy or targeted therapies or PRT. It's important to recognize the symptoms, because based on the symptoms, we may recommend different approach. That's something that is important to acknowledge and recognize. Moreover, in certain functional pancreas neuroendocrine tumors, as Dr. Perez mentioned, is a multidisciplinary approach, and it's important to also discuss these different cases with your endocrinologist. You may need to have an experienced endocrinologist to manage, for example, the excess of insulin, and also discuss your cases with a surgeon and interventional radiologist, because some of these approaches can certainly improve the symptoms related to hormone excess. I understand that sometimes medical oncologists in the communities may not have access to the multidisciplinary approach or having the different teams that can manage these tumors. And that's the reason why with these guidelines, we wanted to establish the understanding of different symptoms associated with the hormone excess to these neuroendocrine tumors, as well as how to manage this. For example, in the case of mesothelioma, I think for the medical oncologists, it is important to know that the everolimus is an option to be used for these tumors, not only to manage tumor progression related to this tumor type, but at the same time, because everolimus has a side effect called hyperglycemia, that can also improve some of the symptoms related to the excess of insulin, besides the somatostatin agonist. I think these recommendations will allow the medical oncologist to recognize the symptoms, and based on what the symptoms cause, then you can have a different approaches that could be added to the systemic therapies options as well.
Yes, beyond systemic therapy, it's important to be recognizing symptoms to provide an individualized approach for every single patient. So then following that overview of symptom management for functioning pancreatic neuroendocrine tumors, Dr. Perez, what is recommended regarding palliative interventions for patients with gastroenteropancreatic neuroendocrine tumors?
Yeah, great question. So I think what's unique to neuroendocrine tumors is that the palliative approach really mirrors what we would be doing for symptom management. Some of these patients are living a very long time with carcinoid-related symptoms, and so the approach that we take for the carcinoid symptom control is going to mirror the palliative piece of it. I think for those who develop a burden of disease-related symptoms, I think it mirrors what we do across the board for all cancer-related complications. And so I think what we attempted to highlight here and included one of our colleagues who focuses specifically on the field of palliative care and neuroendocrine tumors was to never really lose sight of what we've been doing to care for symptom management throughout the patient's journey, and to always re-review the etiology of the symptoms and ensure that we don't focus solely on carcinoid-related issues, but also the symptom management that we would apply to all patients with cancer-related burden symptoms.
Definitely, I think that's a helpful approach to consider when thinking about how to manage these palliative interventions as well. So then, Dr. Del Rivero, what should clinicians know as they implement these symptom management recommendations?
Yes, thank you so much for that question. As we have discussed in the last 10 or 15 minutes, we have discussed the different approaches on the management of gastroenteropancreatic neuroendocrine tumors. Clinicians, I think it's important to know that neuroendocrine tumors is a quite complex disease because we're not only addressing the management of tumor growth, but we're also addressing the management of the symptoms related to hormone excess and the complexity associated with that. When medical oncologists or clinicians implements these recommendations is to understand what symptoms these tumors may cause related to the hormone excess, but at the same time, how do we approach those symptoms? As Dr. Perez said, that is, I think is very important, is to recognize the different type of diarrheas. It doesn't mean that if the patient has worsening diarrhea, it doesn't mean that this is related to disease progression. So it's important to recognize so that way you can address that, because the type of diarrheas can be related because of the Landry type or somatostatin agonist. It could be because of the prior surgery. I think it's important to recognize those in order to address the symptom. And the same with the gastroenteropancreatic neuroendocrine tumors, it's important to know what hormones they produce because there is different measurements that may be added to the systemic management of these tumors. I think that there is two aspects here, and that's the reason why these guidelines were implemented in the sense that not only we're going to manage disease progression of these tumors, so how do we manage the metastatic disease of these tumors, but at the same time, how do we manage the symptoms related to the hormone excess and the different complications. Moreover, I think as we discussed earlier, we need to manage these tumors in a multidisciplinary approach. And something very important is not like one size fits all, because the treatment recommendations, it will depend on different characteristics in terms of the tumor presentation. And hormone excess is one of the important aspects to recognize. So that way we can implement these recommendations that will definitely help the quality of life of these patients.
Absolutely. And using these guidelines in concert with the systemic therapy guidelines is key. And then beyond this impact for clinicians that Dr. Del Rivero has just outlined, Dr. Perez, what does this new guideline mean for patients with gastroenteropancreatic neuroendocrine tumors?
Yeah, I think that's an important highlight of this guideline. It really gives patients a voice. I think it recognizes the fact that these symptoms can go unmanaged or mismanaged or just missed. And patients commonly will come in feeling very frustrated and feeling very ill. And I think it will provide them a means to open up a conversation with their providers and say, hey, this is what I'm experiencing. Let's talk about what's available. How does this apply to me? And I think that can be very empowering. I think it's really hard nowadays with so many sources and resources online, and patients are really left wondering what are the bullet points that they should be bringing to their clinician appointments. And I think that these guidelines provide them a good framework for those discussions.
Yes, bringing these discussion points for patients is very important to be able to have those resources. And we have some patient resources and information available on the website for this guideline, and we can link that in the show notes for listeners. So then you've both touched on the importance of this guideline for improving quality of life, and we continue to see advancements in this field. So Dr. Del Rivero, what are the outstanding questions regarding symptom management and tumor control for gastroenteropancreatic neuroendocrine tumors?
I have to say, whenever somebody asks me that question, the word that I will say is I feel hopeful, because more than 10 years ago, we didn't have that many options for gastroenteropancreatic neuroendocrine tumors. And it has been in the last decade or so that there has been more development in the management of these tumors, as well as in the understanding of the symptoms related to these tumors. But that said, yes, we do need more therapies for gastroenteropancreatic neuroendocrine tumors. of the treatment options that we have. We all know in the field that even though we have disease control by using the different options for the systemic management of gastroenteropancreatic neuroendocrine tumors, we need options where we can achieve an objective response, especially for these tumor types where there is a significant volume of disease. And we see a lot of these patients with gastroenteropancreatic neuroendocrine tumors. And now where the field is going is to make some of these therapies more effective, to develop more therapies as well. For example, immunotherapies of different type of immunotherapy, understand the tumor immune microenvironment of these tumors in order to develop therapies as well. From the antibody drug conjugates, I think that's a new way to also address or treat these tumors type, understanding about the different markers found on these tumors. That way they can be addressed in different ways. Now with the development of new therapies, I think that's something that it can help us as well, not only have disease control and as well as having an objective response, but having a better objective response can certainly also help with the symptoms related to the hormone excess too. In terms of other therapies, I think some of the issues that we encounter is like the refractory carcinoid diarrhea and how do we manage these. We do have therapies that can help us control the diarrhea in the refractory settings, such as the lotristat. The lotristat is one of the newer medications that can help us control the refractory diarrhea. But that said, despite this, that we still encounter the situation where it's sometimes difficult to control. I think in those situations, it will be good to understand more about the biology of these tumors as well and how do we manage, if there is different time or how do we implement these options. I think there is so much to learn. But that said, I feel we're in hopeful times. We're understanding more about these tumors so that way we can help us develop better therapies, not only to have control of the tumor growth, but as well having control of the symptoms. And it's the same with the pancreas neuroendocrine tumors in the metastatic setting. Sometimes it may be difficult to control this hormone excess, but I understanding these and having therapies that can achieve a more of an objective response, I think that will definitely help us more and manage these patients. But one aspect I want to mention, and Dr. Perez also mentioned as well, the fact that we have these guidelines that help us understand about the different symptoms related to hormone X and how to address it. I think is very important because having symptoms related to hormone excess can be detrimental to the quality of life on patients with neuroendocrine tumors that may not necessarily be related to disease progression. And having this information is so important. And I'm hopeful for the different therapies. There's different clinical trials ongoing for neuroendocrine tumors, and especially in the field of PRRT, and a lot of more information will come with the different alpha PRRT and combination therapy. So more information to come in the next couple of years. So this is, in my opinion, hopeful times for this field.
It's great to hear that you're hopeful for all the developments in this field, and we'll look forward to the development and discovery of new therapies and further research, and then hopefully incorporate those updates into guidelines in the future. So I want to thank you both so much for your work to develop these guidelines, and thank you for your time today, Dr. Del Rivero and Dr. Perez.
Thank you so much for having us.
Thank you.
And thank you to all of our listeners for tuning in to the ASCO Guidelines podcast. To read the full guideline, go to www.asco.org/gastrointestinal-cancer-guidelines. You can also find many of our guidelines and interactive resources in the free ASCO Guidelines app, which is available in the Apple App Store or the Google Play Store. If you have enjoyed what you've heard today, please rate and review the podcast and be sure to subscribe so you never miss an episode.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.